So my name is Yves Longtin. I'm the chair of infection prevention and control here at the JGH Donor Hospital, the CIUS centre-ouest de l'île de Montréal. Well, not everyone is at the same risk of being very sick from coronavirus. We know that the people who are older and the people who have basic underlying condition, meaning some medical condition that maybe requires you to see your doctor a few times a year, we know that these people have a higher risk of having a more severe disease. It doesn't mean that they're going to die, right? But maybe their disease will be maybe they'll be a bit sicker, maybe they'll have to be hospitalized for a while. On the other hand, people who are younger, especially the children, seem to be virtually immune to the disease. There's almost no cases among children under the age of 18, and among the few who have acquired it, virtually none had severe disease. So it seems to be a disease that will be affecting much more likely the older people, meaning over the age of 70 approximately. En fait, l'hôpital général juif se prépare depuis des années. C'est pas quelque chose qui est nouveau depuis un mois qu'on se prépare pour ce type d'événement-là. On se prépare à l'arrivée d'une pandémie, d'un virus respiratoire, depuis des années. On avait des comités en place qui se réunissaient régulièrement, s'assurer que les politiques étaient en place, que le matériel était disponible, qu'on avait des stocks suffisants aussi. Bien entendu, depuis environ un mois, avec l'arrivée du COVID, on a augmenté la fréquence des réunions, on a augmenté notre niveau de préparation, mais on peut dire qu'on est un hôpital qui est quand même très bien préparé parce qu'on savait que ça allait se produire un jour. La question, c'était pas si on allait avoir une pandémie, mais plutôt quand. Donc, on savait que c'était une question de temps avant qu'on ait besoin de faire face à ce type de microbe. You've probably heard in the media, there's no secret weapon. People have probably put a bit too much emphasis on the mask. Masks are an important component, especially in healthcare environment and people who need to be in contact with sick people. There's definitely a role there to play with the mask. But if you're healthy and you want to run your errands and go out in the streets, there's really no need to use a mask. The risk of you acquiring something that way is very low. On the other hand, surfaces get really contaminated. So door handles, money, so public areas, you're much more likely to get something by touching an infected surface. So hand washing and cleaning your hands with alcohol, this is very, very important to protect yourself. I think one thing that I think we can really be proud of is the fact that our hospital has been designated as a center for COVID because when the K Pavilion was built, people had the vision to think that this kind of situation could happen one day. And thanks to that, now our hospital is literally almost overflowing with these kind of special rooms, negative pressure rooms. And this will help us really care very well for our patients. And it's really a sign that the hospital really takes these things seriously and can see problems coming many years ahead. And I think that this is the kind of example that shows how the hospital can really make a difference towards its own population.